My name's Alex O'Neill. I'm Code's Professional Services Manager. I manage our consultancy team, and I also do a lot of the development work on iComply. So that means I spend time in practices and researching a lot of the CQC changes and feeding that back to you in webinars to Code members so that you have the most up-to-date information. And today we're going to be discussing the new CQC KLOE on Well-led, which is kind of their catch-all KLOE. If you're not safe, you're not well-led. If you're not responsive, you're not well-led. We'll see how a lot of it feeds into to well-led, and there are specific things about how you are well-led or not as well. So that's just a little bit to get going. Now, we've slightly changed the format on the beginning of these slides to match the GDC's new CPD requirements for verifiable CPD. So we have an aim today, and the aim is to increase understanding of the new inspection regime and help practices prepare for inspection. That's our main reason for giving these webinars, is to help you to actually be more informed and to pass your inspections, hopefully. So we have some objectives here. The first one is to examine the inspection prompts for Well-led in the provider handbook. So I'm going to be looking at the provider handbook, looking at the prompts. We're going to do a little bit of an exploration of that. We're going to explore the CQC's examples of evidence for Well-led in the provider handbook. They do give a list, but they do say it's not exhaustive, but we'll look at that. We're going to look at how practices are being judged regarding Well-led in the recently published inspection reports. So I've been looking at all of the inspection reports that have been published so that you're getting the most up-to-date information of what the CQC is looking for and what's coming out on those reports. And it's quite interesting to look at that. And we're also going to see how the iComply application is going to help you be well-led with the KLOE report, with the well-led section. The KLOE report is now done, so hopefully you've had a chance to have a look at that. And we're also going to talk about the importance of practice meetings and how to deliver an iComply. We said an iComply training meeting. It's an iComply practice meeting, a compliance training meeting, which may be different from the way you've been doing practice meetings previously. So we're going to see that the inspection prompts are a bit more intuitive than the safe inspection prompts, and there is a clear pattern emerging in what the CQC are looking for. And it basically comes down to, with Well-led, it's having a clear leadership and governance structure, leading by example, caring about what your patients and your team think, supporting your team to develop with CPD and appraisals, having regular meetings where you update your team on your policies and your procedures, and you share learning, and having a governance system that operates effectively, so one that you're actually using and it works, and the one that leads to continuous improvement, which is one of the prompts, as we'll see. Okay, so we have some learning outcomes as well. So fingers crossed, by the end of this session, you hopefully will be able to explain what the CQC mean by well-led. You can describe the well-led inspection prompts, so have a good idea of them, and explain to people within your own teams what the CQC are looking for when they come and see whether or not, and ask those questions regarding whether or not you're well-led. You should be able to deliver an iComply training meeting, and you should be able to demonstrate to an inspector how your practice is well-led using the KLOE report within iComply. And that's what it's designed for, to be an inspection hub for your practices, so you can show an inspector how you are well-led, and he has those prompts that you have on the inspection, on the KLOE report. Okay, that transition should have gone by now. So it's a little bit of background. Just I know some of you have been following this series closely, so this will be a bit familiar to you, but just for anybody else who hasn't, with the CQC inspections, they have changed with the new fundamental standards and the key lines of inquiry that came into effect from the 1st of April this year. The main reason they changed is because there was a need for consistency. The CQC inspections weren't consistent, so there's been a big change, and one of the things that I'm always saying to clients, and my team are always making sure clients know, is that just because you passed an inspection under the last regime where they only looked at 5 of the outcomes doesn't necessarily mean that you're compliant, because there's about 2/3 of the outcomes that they haven't looked at. And the main difference is this time when they're coming back in the next inspection cycle, they're going to be spending the whole day at your practice, and they're going to look at every single fundamental standard through the KLOEs. Are you safe, effective, caring, responsive, and well-led? Okay, so just a little bit of expansion on that. The new inspection regime is data-led, so they're researching you up to 8 weeks before they come into the practice. They're using the key lines of inquiry. There's a real quality assurance focus, and by that, they're closing the loop. We talked in the last webinar about risk assessments and audits and the importance of making sure that actions are created out of those risk assessments or audits, and also that they were accurate and you're not just ticking the box. And now they're also looking that you're closing this loop. So this feeds into well-led quite a lot. They're checking that you're closing this loop and you're sharing that learning, and that what you find out through surveys, through audits, through risk assessments actually have a benefit and lead to continuous improvement within your practice. They're using provider handbooks. I always say this in every webinar, but I really, really strongly recommend that you go to the CQC website and download the handbook. It's about 60 pages long, and it's really, really helpful. And it will tell you the sort of things that they're looking for. Specialists and experts, the latest information is they are sending a dentist with a specially trained inspector to your practice, so you've got 2 pairs of expert eyes looking at everything for a whole day. And patient and team focus is not just about policies, so they're talking to your patients, they've been interviewing the majority, if not your entire team, and asking them questions about when they were last trained on policies, how much they understand the policies. This is the information that we're hearing from our member practices. Okay, and there's a copy of the provider handbook. If you want to download it, that's what it looks like. So the key lines of inquiry. So these are the key lines of inquiry if you want to have a quick look. Are you safe? Are you effective? Are you caring? Are you responsive? And are you well-led? And today we are looking at well-led. And by well-led, they say that they mean that leadership, management and governance of the organisation assures the delivery of high-quality, person-centred care, supports learning and innovation, and promotes an open and fair culture. And obviously that's quite a lot condensed in there, so we're going to explore that a bit more in the next few slides. Okay, so well-led KLOEs related to fundamental standards. There's quite a lot of fundamental standards that are linked to the KLOEs. That are linked to this KLOE in particular, and most of them now. In the new version of the handbook, they actually added, in the final version of the handbook, they added more standards to more KLOEs. So it's almost most standards are under most KLOEs. So I'm not sure how helpful that is, but if you don't have our iComply system, then one thing you could do is cross-reference the fundamental standards document with the KLOE document in order to figure out what they're going to be looking at when they're asking, are you well-led? Obviously, if you have the iComply system, you've got access to the KLOE report when we've done that hard work for you. So this is where you can have a look at this and try and figure out if this you can have a look at this and you can try and figure out with the fundamental standards document if that would work in what they would be looking for in your practice. Okay, so these are the well-led prompts from the provider handbook. And the first one is, do governance arrangements ensure that responsibilities are clear, quality and performance are regularly considered, and risks are identified, understood and managed? Now there's a lot of information that they give examples of evidence that go with these prompts, and for this one they're looking at things to do with your actual governance arrangements and your management structure. Do you have a management structure? Is everyone clear on their roles? Are your staff supported to meet their CPD requirements? Under the second one, does the leadership and culture reflect how does the leadership and culture reflect vision and values, encourage openness and transparency, and promote delivery of high quality care? So firstly, they're looking at, do you have leadership? Do you have good leadership? And do you have a culture? And do you have vision? And is this all aligned? Do you have a management team that are striving to continuously improve, to be better, to be open? On the third one, how is quality assurance used to drive continuous improvement? I think this is probably one of the most important ones, and they're looking at this quite a lot under well-led. They're making sure that you're closing that quality assurance loop, that you're actually generating actions, you're dealing with them in a reasonable time frame, and that you're sharing learning in meetings, which we'll see on the next few slides, with your team members. How are people who use the service, the public and staff engaged and involved? So this is to do with your satisfaction surveys, to do with if you have a staff satisfaction survey. If you're an iComply member, it's an optional activity, highly recommended that you do staff satisfaction surveys so your team feel that they're listened to. And we'll see this on the next few slides of how they're looking at this. Okay, so this is what's actually coming out on the Well-led report. When practices are being inspected and the reports are going online, the Well-led section of that report has these 4 sections. And what I've done is I've sort of summarised what's coming under these 4 sections and what they're looking at in the actual report, which I think is probably more useful than the inspection prompts and examples of evidence, looking at what's actually coming out on the report. So the first one, leadership, openness and transparency. Under this, they're looking at information sharing with your team and with the general public as well. So if you've made any changes to the practice, have you actually informed the general public that you've done this? So obviously, if you're an NHS practice and you've got a friends and family, and you're doing the friends and family test, you have to publish those results somehow, probably on your notice board. But if you're doing patient satisfaction surveys, are you letting your patients know what changes you've made to the practice because of those surveys? Governance arrangements. This is covering, there's more stuff in the first point. There's listening to the team, clear leadership structure, whistleblowing, having a blame-free environment, and regular meetings. And the governance arrangements, they're looking at clear responsibilities, audits and risk assessments work, and that you have a system in place. You actually have a governance system. So they're looking at your scheduling, your planning. Can you satisfy them that in the next 12 months, you're going to be doing everything that you need to do to meet the regulations? The third one, practice seeks and acts on feedback from its patients, the public, and its staff, its team members. So this is to do with your comments and suggestions, books or boxes, your actions from that and feedback, and that the team feel listened to, and again, publishing what you've done. The last one is management lead through learning and improvement. That's to do with your values and your vision, how well that's communicated to your team. So if you have a mission statement, do your team know what your mission statement is? If the practice has published values, do they know what those are? And do the leaders, the leadership and the management act in line with that? It's very easy to have values and mission statements and then not follow them. So obviously, are you doing what you say you're doing? And are you leading on that? So as managers, leaders, are you actually leading this and driving continuous improvement? Are you identifying learning issues and giving that training to people, helping them through appraisals? They're mentioning appraisals a lot in Well-led as well. And are you supporting your team members to do their CPD? So this is an actual quote from the summary that they have on the Well-led section. So if we look at this, what is a well-led practice for the CQC? So this one, if I read it out, the practice had an effective leadership structure with the practice manager monitoring the services they provided and driving improvements. Staff were aware of their roles and responsibilities and how they impacted on the overall vision of the practice. Staff were encouraged to identify improvement areas, and these were actioned where relevant, probably through staff meetings, giving them that opportunity to give feedback. Appraisals were in place for all staff, training and development was available if required, and performance was monitored. Risks to both staff and patients have been identified. These were monitored and reviewed. The practice assessed and monitored the services they provided through patient feedback, audits, and monitoring complaints. So the key points from this practice, which they considered to be well-led, is that they have an effective management structure. The manager is monitoring and driving improvements, and as iComply leads, most of you I imagine are iComply leads for your practice, you will be doing this. The staff are aware of their roles and responsibilities. They have clear job descriptions, I would imagine. And the staff feel listened to, they feel valued, they are appraised annually, they're trained, and the risks are monitored, reviewed, and are dealt with, and feedback is given. So we move on to a less well-led practice. The practice manager was responsible for 3 dental practices, and the division of their time appeared to have an impact on their ability to effectively manage all aspects of the day-to-day running of this practice. We found that the quality monitoring of the practice had not identified areas for improvement in a timely way, and that some issues reported by the practice had not been acted on by the organisation. The company was undergoing significant changes centred on the development of a new national brand. Information from staff meeting minutes and discussions and observations during the inspection indicated that the organisation had not effectively engaged with staff in respect of these changes. So you can see here is sort of the opposite on some points. So ineffective management structure. The manager is not monitoring and driving improvements. And obviously through iComply, you're using a quality assurance cycle. It prompts you always to make sure that you're updating and you're scheduling to-dos and you're actually improving the practice based on the information you get from risk assessments or audits. The staff don't feel listened to, and the manager doesn't have the time to do anything. She's spread quite thinly, or he, sorry. The staff don't feel valued, quality's not monitored effectively, and issues that have been found haven't been dealt with within a reasonable time frame. So we can see how this goes sort of a step beyond what they were looking for with the old inspection regime. So that they're looking at, a lot of this is whether you have a governance system and it works and you're using it effectively. And we always say, obviously, if you've got iComply on the application, or if you have the manual system, then obviously you're paying for a service and you should use it. Obviously you should use it. And obviously complete this quality assurance loop by doing it, finding out what you need to fix, fixing it, and then if you can, telling people that you've fixed it as well. They like that a lot. So just some other points from examples of not well-led practices and how with iComply you are meeting these points. So you can see with not well-led, a file placed in the waiting room contained the results of the patient survey. The information listed a range of positive comments received. It did not contain details about overall findings or any survey outcomes to inform patients of how the information is being used. So obviously in iComply, we have the patient satisfaction step, and we have the meeting to feed back to the team about what we've done in order to improve patient satisfaction in the practice. You could also go one step beyond that, and it's not a bad idea to put a poster up and tell patients what you've done. Second one, at the time of our inspection, the practice did not hold regular staff meetings and staff appraisals had not been undertaken. Well, we have in iComply a staff meeting every single month that is based upon the policies and reviews that you've done that month, so that you can update the team and they know what they need to do in order to meet the regulations or what the changes in policy are. Management of the remaining paper records was not good, as they were stored in places where confidentiality was not securely protected and they were not safe from damage by flood or fire. So in iComply, as you know, you're doing the information security risk assessment each year, or reviewing it once a year. So you are making sure that this is covered and that you are that your records are protected and people couldn't get access to them and they can't be easily destroyed by flood or fire. The last one there is there's no audit plan and no monitoring of clinical practice or record keeping, which could be used to make improvements to the service. And obviously in iComply we have the clinical audit step, and the whole system is a quality assurance system to make sure that you are monitoring and improving. So if you're not doing clinical records auditing, then I would highly advise you do clinical records auditing. So then examples of what they've found in the inspection reports of well-led practices. So we can see with the top one, the practice audited areas of their practice as part of a system of continuous improvement and learning. For example, infection control and patient records. Patient record audits were completed every 6 months and there was evidence of actions taken. So we've got continuous improvement and learning here. So a good piece of advice for you, I think I gave the same one in the last webinar, is go and look at your last audits, go and look at your last risk assessments. Have you dealt with the items on there? And if not, you should probably get them done. The second one there, an audit timetable was in place to regularly audit the services they provided. The practice had subscribed to a software program designed to provide effective monitoring and assessment processes. The audit timetable identified the type of audit required and the frequency. These were clearly documented and carried out at the identified timescales. Now, This to me sounds very much like iComply, and obviously the practice there, the CQC didn't have any other complaints about this practice. They were happy that they had a system, that everything was scheduled, and it was all being done in the required timeframes. And they could also see that schedule for the next 12 months. They could see what was going to happen ahead. And then the last one is, there were arrangements for sharing information across the practice on a daily basis and through regular practice meetings. Staff told us this helped them keep up to date with new developments and policies. So this is something we're going to touch on when we look at iComply, just the importance of meetings. The regular practice meetings are about sharing and updating amongst other things, and we really strongly recommend you do that hour-and-a-half meeting once a month. You probably need around an hour and a half for it, as we'll discuss in a bit, to make sure that your team, depends on the size of your team, but to make sure that your team are aware of all of the changes and they could answer those questions to an inspector. So, other KLOEs sometimes linked to Well-led. I won't read all of this slide because it's actually the same slide that I used for the SAFE presentation, but it's quite interesting looking at focusing on Well-led in the inspection reports. And what you'll generally see, as I mentioned at the beginning, is that practices that aren't safe are not well-led. So if they're not managing safety well, there will be something in Well-led to say that they are not managing safety well, and therefore the leadership is lacking in some format. If the practice isn't effective or caring, if the staff aren't being trained properly, aren't being supported properly to deliver that treatment, then they would say that the leadership of the leadership may be lacking. The practice is not well led. The same with responsive. If the practice isn't dealing with complaints properly or patient feedback properly, or in a timely manner, they will turn around and they will say that the practice isn't well led. So it's kind of a catch-all, and sorry, excuse me, got a bit of a dry throat today. It's a kind of a catch-all, and you just got to be aware that if they find issues elsewhere in the practice, there'll probably be something written on the report about how well led you are because of that issue. So, just a little bit of practical advice. So if how well led you are, think like an inspector. I always say it's a good idea to put yourself in the feet of an inspector and try and see what they would see, or the feet in the shoes of a patient and try and think what they would see. It's not as easy as with the SAFE, but there are a few things that are helpful to help you think like an inspector on well-led. So I've put down their culture and attitude. When an inspector, an auditor, my team, when we go into practices, it's quite easy to see what the culture of the practice is as soon as you walk in and what the attitudes are. If the team are hostile to an inspector asking questions, then it's going to put them a little bit on edge about what's the leadership of that practice, what are the visions and the values, and if the team members all think that compliance is a chore, where are they getting that from, and why is the practice ethos sort of around that. This could be a whole other presentation, so I won't go into how you change the culture of your practice and how you look at it. If anyone does want to talk to me about that at any time, then I'm happy to. But it's if you go into a practice and you stand at the reception desk, and which has happened to me once, and there's 6 people behind the reception all chatting and no one paying attention to you, then it speaks volumes about the kind of culture of the practice. Team knowledge. So how knowledgeable are your team? Could they tell the inspector when they were last trained on the policies? Could they tell the inspector what's on the policy? Obviously not word for word, but do they understand? And is the policy what's actually happening in the practice? Schedules. Do you have a schedule for when time-sensitive things need to be completed? Is it on iComply? Is it visual? Is it in Excel? But do you have a schedule? Can you satisfy the inspector that you're well-led, and are you confident that an inspector would be confident that you're going to get everything done in the next 12 months that you're supposed to do? So all of those time-sensitive things like 6 monthly audits, annual health and safety risk assessment reviews. And then instrument drawers. I put this on the SAFE one, but I always think it's a really good thing. You can tell a lot from a practice by just going into a surgery and opening an instrument drawer. Are the right things bagged that should be bagged? Are there any single-use items bagged that have obviously been reprocessed? Is everything date stamped? Who's responsible for this room? What does the dentist think who's practicing in this room? What does the nurse think who's responsible for those drawers? What's the head nurse doing who should be auditing it? What's the manager doing who should be overseeing this? if you walk into a surgery and you open drawers and you find that they're a mess and they're not as they should be, then it can almost speak volumes about the levels of management within the practice. So I think that's a very, very useful thing for everyone to do. And then obviously training evidence and minutes. So they're not a surface sign, it's not something you can see as soon as you walk into a practice, but do you have meeting minutes for all of your meetings? Do they say what important things were discussed and what needed to be dealt with? So, how code helps you to stay well-led. Obviously, we have the evidence of compliance, the G106A, which is in iComply in the system for everybody. So that's a good list to look through, and I believe that includes KLOEs now. Health checks and mock inspections. Health checks are our full-day audits where we come and check you and look at all the regulations and see how you are compliant with those, and we give you an action plan and some advice on how to catch up. Which may be good for people who have passed their last inspection, but the inspector didn't look at a few things. And mock inspections as well. Obviously now we have a good idea of what they're looking at, and we're going to come in and we're going to help you coach your team and do a bit of an audit, but also ask questions and act more like inspectors and auditors. Guidance based on actual inspections, well, that's the information you're getting right now. And obviously this is based on me talking to our members and me researching the inspection reports. The KLOE report on the well-led prompts. So we'll have a look at that when we go into iComply. We'll look at the well-led prompts and see how you can see what you're showing within your compliance report and what you can show an inspector when they come in. We really wanted this to be the hub for inspection, so that when the inspector comes in, you can sit them down, put them in front of the inspection report, the KLOE report, and they can filter well-led and see what you've done, when you did it, or when you've got it planned to do it next. And then seminars, we just finished a series of 3 seminars, but we are going to be announcing some more. I think the next one might be in Bristol, and that's when we spend a whole day discussing all of these issues in more detail than we are today, and obviously giving you a lot more personal one-to-one attention. And then free webinars. So if you're an iComply subscriber, which I imagine the majority of you are today, then you are getting these webinars free of charge, and they are part of the iComply Expert series. And if you complete 10 of these webinars and do the CPD questions afterwards, and then get in touch with the office, you'll be given another CPD questionnaire, and we will give you an iComply Expert Award. Okay, we've also got the iComply report. So we have the Fundamental Standards Report and the KLOE report. These are linked to the standards and linked to the prompts for the Fundamental Standards Report. But more importantly, the KLOE report, what we do is we break down those examples of evidence and those inspection prompts in the back of iComply and create this big spider web of linking, so that when you complete anything in iComply and you mark it as complete, you are putting that entry onto your compliance report that you or an inspector can look at to see how you are safe, caring, effective, responsive, and well-led. Okay, so what we'll do now is we'll go and have a look at iComply. We'll have a look at the well-led section of the KLOE report, and then we'll discuss why practice meetings are important, and how we feel is the best way to give meetings, and how you can use iComply to schedule actions coming out of meetings and to record important things to show that you've completed that quality assurance loop to an inspector, in line with what we were looking at earlier of the sort of things they're looking for inside a practice. We're going to look at the compliance report and how you get to the compliance report and how you would navigate it and how you could show that to an inspector. So if you go down the left-hand column here and to this section here, we've got the compliance report section here. If I click on that, you can choose your practice. As we all know, iComply can take 1 to 100 practices. I've got 2 on here. We're going to look at A1 Dental. And I've got 2 reports, so the Fundamental Standards Report or the KLOE report. We're going to look at the KLOE report, and I'm going to click on Inspection Prompts. So we've got, under Inspection Prompts, this button here, this toggle button, which allows us to filter them. So if the inspector comes in and says to you, I want to look at how well-led you are, you can sit them down in front of iComply, make them a cup of tea, put this inspection report on them, press toggle in front of them, and then click on well-led here, and click Apply Filter. Now we're going to scroll down here, And these are the inspection prompts, well-led 1, 2, 3 and 4, as we saw earlier. And you'll see a lot of the things that we were discussing earlier that link in with those inspection prompts. So for example here, I comply team responsibilities and logins. So this is to do with governance, to show them that you have a governance system and everyone knows their responsibilities within it. And we can see here that we completed this on the 27th of the 5th. We've organised a team, everyone's aware of their responsibilities. And our evidence is on the organisational chart. It's also in I comply in the team responsibilities section, but we have an organisational chart and we can show the CQC that everybody is aware of what they need to do. We've also got governance about clear registration to do with CQC registration here and reviewing the statement of purpose. And what we did on certain days, we reviewed the statement of purpose and we realised that we had to update it because we added a surgery. And I won't go through everything in here, but it includes all the items we saw before. Your appraisals are in this section, your whistleblowing and fitness to practice is in here, your duty of candour requirements are in here, your CPD is all included in well-led. We also have a whole section to do with meetings, obviously because that whole section of, I can't remember the prompt, it's well-led 2. I believe, sorry, well-led 3, it's right in front of me. How is quality assurance used to drive continuous improvement? To show them that you are doing that feedback loop, that you're sharing learning with the team, you're asking them for their opinion as well. So whenever you complete the meetings and put notes, they will appear here, which is what we're going to do in a minute. And then down here, we've also got risk assessments or audits, which are part of well-led 1 to do with governance. They're also part of the safety KLOE, so there is some duplication there, but obviously they cross over, so they're in both sections of the CQC documents. We can see we've done some risk assessments here, when they were carried out and what we needed to do, and audits as well, and we've created actions to buy gloves, and we've recorded those as to-dos in the section. Now we looked at that at the last webinar, but we'll look at that again, of how you add to-dos to the system. So that gives you an example of how you can look. And once you've completed a whole cycle of I comply, this report will be full. And what you'll have always is your latest date that you did it. So as you do it in the next cycle, it will update it with the next date. So the CQC will always be able to see what you've done, when you did it, and how up to date you are. Okay, so if we now look at practice meetings, because we're going to discuss how to deliver a practice meeting and why they're important. If I go onto the calendar, and I go to month 1 of the cycle. Now, in month 1 of the cycle, well, firstly, if we discuss why we need regular practice meetings. Now, regular practice meetings are essential to quality management for several reasons. It's your opportunity to update your team members on any policy and procedural changes you've made in the last month. And this is key in the new inspection regime, to make sure that they're aware of what you've updated. That's in order that they can understand, they can carry out their duties, and obviously they can answer questions to an inspector about those policies and about those procedures. It's an opportunity for you to feedback results from surveys, comments and suggestions, to share learning, and to either inform your team of actions taken, or, as we'll see in a minute, to get their input on what actions you could take. Maybe they have a good idea of how to fix a particular problem. It's an opportunity to share learnings from complaints as well, and it's your team members' opportunity to discuss any issues that they feel impact on that particular area or health and safety. It's also very important for evidence-based dentistry that they can share skills and experience in the meetings, if they have any skills and experience to share with the rest of the team. So carrying out team meetings meets a lot of quality assurance requirements and will help satisfy the CQC that you are a well-led practice. And it's important in iComply to try and stick to this monthly cycle of administration step up here. Oh, 1 second. I didn't mean to click on that. The administration step, and then the meeting at the end of the month, and try and do it within the month. Try not to start moving stuff month to month, because you don't want to get a domino effect too much in the cycle. Obviously, if you start moving one meeting, you're going to have to move the next administration step, and that could just carry on. So try and stick to monthly cycles. And quite often I say to principals who want to know how to know if the practice is doing well with compliance, is if you can log in at the beginning of one month and look at the previous month and it's all grey, it's all been completed, then you know that the practice is on track with their compliance. And it's that simple. So what do we need to do before the meeting? Well, we need to decide on meeting dates. You've got a 12-month calendar within iComply. I really strongly recommend scheduling them now. And probably if you like doing them on, say, a Wednesday, like this practice does, put them on the last Wednesday of every month to give you time to do the administration step. Have enough time to do them. We recommend an hour and a half to do these meetings once a month. And that's to give you enough time to give that information to the team and enough time for them to give points, to raise points that are obviously applicable to that meeting. Try and make the meeting sacred, get buy-in from the principal, and if you are the principal, then try to make those meetings sacred so that they're not going to get moved for emergencies, and you manage to schedule them in a certain way so that they are the same day every month. You also want to try and make sure that you've signed off all of the compliance reviews before you deliver the meeting. This is important because then obviously you have the correct information that's going to tie up with the agenda that we've given you in the practice meeting. You get the agenda and it matches up with the practice meeting. So if we have a look at that now, if I click on this administration stat, we can see in this month we've actually completed pretty much everything apart from patient satisfaction. So if we click on patient satisfaction and have a look in there, I've already written the notes and I saved this earlier. So what I can see is we've carried out the satisfaction surveys, we collated results, and we've generated an action regarding the archers as a to-do. This is a practice where the patient said that they were tired of watching National Geographic and they wanted Radio 4. So we've already put that on our calendar as a to-do to sign off. And we're going to feed that back into the practice meeting. So we're going to tell the team what we've done. And maybe even we'll put a poster up to let the patients know that we appreciated the feedback and we've got rid of the TV and we now have a radio. We also want to discuss the problem with short notice cancellation lists and see what the team thinks. Because one of the items that we got on our patient satisfaction survey was that the patients felt that our short notice cancellation list didn't work. That we were taking names on a list and that the patients were never called. So it made no difference to the practice. It wasn't an efficient system. So we want to discuss this with the team. So if we sign this off and mark it as complete, which means it's now going to appear on our compliance report as complete with those notes. And we go back to the administration step and back to the calendar. Oh, 1 second. Sorry, I'm going to sign off the whole administration step as complete now. We've done everything for this month. So go down to the bottom here and I can mark that as complete. Now if I go back to the calendar, see that's now gone grey, that's complete. We've got an action to buy a radio. So let's say we've done that now. The patient's requested no more National Geographic. Radio 4 has been suggested, so we've bought the radio now. We created the to-do on the calendar and we're going to complete that. So if you've been following these webinars on YouTube, then if you watch the last YouTube webinar, you'll see how to create to-dos. We'll also have a look at it after this as well, but it's there for you. So we're now ready for the meeting. So if I click on the practice meeting here, I've got some notes about how to give a meeting. You can read those in your own time. But there are some interesting points there to give advice about minutes, etc. And everything afterwards will go into folder 10. So we're going to go down to the bottom here, and to related templates. I'm going to open related templates. So in here I've got a register that I can download, and I will want everybody to sign that. For the purposes of this webinar, I won't download the register, but what I'm going to do is download the agenda. So the items on this agenda, and every single monthly agenda matches the compliance reviews that you've been doing. So they've already been put as items on that list and that agenda for you to deliver that meeting to your team. Obviously it is a template though, so I do advise customizing it, and perhaps sending it to your team a bit in advance, allowing them to add any AOB items that they feel match that topic, that are important around that topic, and obviously any health and safety or anything that's really, really urgent. So if I open that template and enable editing, we can see in the main body here, we've got all of the items, as I said, that were on that list in the administration step. And we see what the practice has learned from complaints and patient involvement. But we're going to add another thing to this because we want to discuss the problem with short notice cancellations. And then I'm going to potentially give that to my team members in advance so they can suggest any other AOB items for the list. But obviously, as I said, it's a template. Most of the stuff is there, but you may want to edit it a bit to add some items that are customized for you. Now, if we go back to iComply, what we're going to do now is we're going to want to deliver the meeting. So before the meeting, what we might want to do is print off some of the policies and procedures or email them to people, especially if we've updated them. And we're going to deliver the meeting. Now, when you deliver this meeting, it might not be like practice meetings you've done before. And this is an important point, is that it's a compliance training meeting to make sure that your team are up to date with what you've been doing. So it has to be quite tightly controlled, and you want to chair the meeting. And what I mean by this is you've got a lot of information to give across, so you want to be quite succinct, to the point, and allow people to raise their hands and ask questions. But if they are off topic, I'd suggest shutting them down very, very quickly, obviously in a nice way, asking them to bring that to you afterwards, and then moving on to the next point. And this is a key thing to get through this agenda, and something we do when we actually do compliance consultancy. One of the things we've done a few times is train managers on how to deliver these meetings. So if you do want help with that, then our team can help you with that. But you want to be quite succinct, and then in this meeting, and then obviously you want to ask them for their feedback. And then in this meeting, obviously we said we wanted to discuss the problem with the short notice cancellation list. So let's just say we discussed this with the team, and one of the team members, Tina, suggested that in her old practice, they had a practice management software that had a built-in short notice cancellation list. So when people cancelled, they were automatically texted. And that sounds like a great idea. So what we want to do is we want to create that action, and we want Tina to go and do that. And we'd like a record of that. So you can put it on the meeting minutes, but what you also might want to do is record that in iComply, so it's going to appear on your compliance report. So in the audit box, the actions taken for this activity down here, you can say, well, we had to download a template. We did have to adapt it. Now, actions arising from this activity have been completed or have been scheduled. So we're going to schedule the action afterwards. So we can sign it off and say we've done that, because we're going to do that in a second. And in here we're going to say something like held meeting, fed back results from survey, and we're going to add a point of what we decided in the meeting was that Tina is going to go off and research these practice management software, and she's going to feed it back at the next meeting. So we want to put that down. So Tina to investigate solutions to short notice cancellation problems. And if you want to really impress the inspector, you could say highlighted in the survey. We've put everything in folder 10, so we'll put that there. And we're going to mark that as complete. On the calendar as well, what I can also do is go to the to-dos, and if I really want to put it on my report for the inspector to see, I can add it to Tina's calendar for her to research it next week or in a few weeks' time. So put that in the middle of June for her, and that will appear on her dashboard for her to deal with. I'll just put research solutions. I'm just speeding up a bit because I've just become aware of the time. And it's a test, so I'll just put that there. But if I create that, that's now going to appear on her calendar as something for her to do. If we then go and look at the compliance report, and we go back to the key lines of inquiry, inspection prompts, and go down to well-led, and apply the filter, what you can then see, I'm going to scroll down quickly, is here under well-led 3, how is quality assurance used to drive continuous improvement. We completed that meeting on the 28th. We held the meeting, fed back results from the survey. Tina's going to investigate this, and it's in folder 10. So hopefully that's in your minutes, it's in folder 10, and you could show that to an inspector when they come in. Also, it will now appear, once it's completed, it will appear in your to-dos list on your report as well. So you can show the CQC what you've done about it.